Have you ever found yourself wide awake at 2 in the morning, staring at the clock and wondering why you can't slip back into a restful sleep the way you used to? Perhaps you mentioned it to your doctor, or they caught wind of your groggy mornings, and soon you were handed a prescription for a sleeping pill. At first, that pill might seem like a lifesaver, finally granting you the deep rest that's felt elusive for weeks or months. Yet for many people over 65, what starts as a temporary solution can morph into a concerning dependency, with side effects that undermine health and quality of life. Your doctor may not go into detail about these pitfalls, maybe because time is short during appointments, or because the emphasis is on quick symptom relief. But the hidden truths about sleeping pills after 65 are well documented, and can range from mild grogginess to severe physical and cognitive risks. In this conversation, we'll uncover what's really at stake with long-term or frequent use of these medications, why they affect seniors more intensely than younger adults, and how you can address sleepless nights without placing your well-being on the line. By the end, you may feel more informed and ready to tackle insomnia in ways that preserve both your rest and your independence. You might recall a time in your youth when your head hit the pillow and you drifted off without a second thought. As the decades pass, shifts in circadian rhythms, hormone levels, and sometimes medical conditions can erode that once effortless transition into slumber. Doctors frequently prescribe hypnotic or sedative medications, benzodiazepines like temazepam, or non-benzodiazepines often dubbed Z-drugs, such as zolpidem or isopicolone, to ease you into sleep. While these drugs can indeed knock you out for a few hours, they often do so by blunting the central nervous system. Your brain, essentially, is subdued, rather than guided through the natural sleep architecture your body truly needs. In younger individuals, the body may bounce back more easily from this sedation, but once you cross 65, your metabolism and liver function can slow. This means these drugs linger in your system longer than intended, boosting the odds of confusion, disorientation, and next-day drowsiness. Imagine waking up feeling less alert, with your reflexes dulled as though you haven't truly shaken off the sedation. That initial relief you felt from finally sleeping can morph into a vicious cycle, where you rely on pills each night, yet you're physically and mentally off kilter throughout the day. Worse, you may find you need higher doses over time to achieve the same effect because the body develops tolerance. Then, when you try cutting back, you face rebound insomnia, your sleeplessness returning more fiercely than before, or withdrawal symptoms like anxiety, sweating, or even trembling. One quiet danger is the risk of next-day falls, especially if you wake up in the middle of the night to use the bathroom. If the sedative is still active in your bloodstream, your balance and coordination are impaired. A single slip on the way to the kitchen could lead to a serious fracture, possibly landing you in the hospital for weeks. It's no small matter when you're older, and each fall can have cascading consequences for mobility and independence. Doctors might not dive into these nuances, sometimes out of a desire to help you quickly or because they believe short-term use is safe enough, yet many seniors end up renewing prescriptions month after month. The question becomes, is the short-term fix for insomnia worth the long-term gamble with your cognition, balance, and overall well-being? Studies have shown that older adults on sleeping pills, especially benzodiazepines, have higher rates of accidents and hospital admissions. There's also an association with memory impairment and confusion in some cases, because sedation can interfere with the brain's ability to form or recall information. The phenomenon might be subtle at first. Maybe you find yourself forgetting appointments or feeling mentally fuzzy. Over time, it can erode confidence, leading to a creeping suspicion that you're losing your edge mentally, when in fact the drug is partly to blame. Another issue is that these medications rarely address the root causes of poor sleep. Insomnia after 65 can stem from pain, frequent urination, anxiety, depression, or even changes in your body's internal clock. If you're dealing with chronic pain, for instance, a sleeping pill may mask the discomfort enough to let you doze off, but it's not treating the inflammation or joint issue causing the pain in the first place. If anxiety or depression is triggering restless nights, sedation might offer a temporary hush to the mind's chatter, but the underlying worries remain unprocessed. Consequently, you risk missing the chance to tackle those deeper problems with targeted treatments like pain management strategies, pelvic floor therapy for urinary frequency, or cognitive behavioral therapy for anxiety. Instead, you stay in a loop of sedation, never quite feeling fully rested or stable. It's also worth mentioning that many older adults take multiple medications for blood pressure, cholesterol, diabetes, or arthritis. Adding a sleeping pill on top of this pharmacy can spark interactions that your doctor may not fully detail. For example, some sleep aids can exacerbate breathing problems if you have conditions like COPD or sleep apnea. Or they might intensify the sedative effect of other drugs you're prescribed. The synergy can result in deeper than intended sedation or sudden drops in blood pressure upon standing. You may experience lightheadedness when rising from a chair, leading you to grab furniture to steady yourself, which is another moment you risk falling. Some doctors do thorough medication reviews, but not all do so as meticulously as you might hope, especially if you see multiple specialists. You could end up with a prescription from your primary care doctor layered onto something your cardiologist suggested, with neither fully considering how all these pills interact. The marketing around certain Z-drugs or newer sleep agents can be deceptive. Advertisements paint them as safer with fewer next-day side effects. While it's true they may differ from traditional benzodiazepines in how they bind to brain receptors, side effects can still hamper seniors more than younger adults. Sleepwalking, sleep eating, or even sleep driving have been reported with some of these drugs, leading to bizarre episodes where the person has no recollection the next morning. This phenomenon might be rare, but if it happens to you, it's extremely unsettling and potentially hazardous. Meanwhile, the logic for prescribing them is often based on clinical trials that might not have included many participants in their 70s or 80s. Real-world usage can reveal a different safety profile. In other words, a drug proven safe in a 40-year-old might pose significant risks for someone 30 or 40 years older with multiple health conditions. If your doctor hasn't spelled out these concerns, it's not necessarily that they're indifferent. Time constraints or the assumption that you just want immediate relief might be at play. Some physicians also assume patients won't commit to alternative therapies, but many seniors are surprisingly open to non-pharmacological solutions if they're explained well. You might find that adjusting your evening routine or sleeping environment can be more effective than popping a pill. For instance, you can limit fluids late in the day to reduce nighttime bathroom trips, or adopt a brief, calming ritual like gentle stretches or meditation before bed. If pain is the culprit, maybe you need a better mattress or a change in your pain management plan. If restless thoughts keep you awake, short sessions of cognitive behavioral therapy for insomnia, CBTI, can teach you coping strategies. CBTI specifically addresses the anxious cycle of dread around bedtime that many seniors experience. By retraining your relationship with sleep, you cultivate a healthier pattern that might last far longer than any pill's effect. Another angle is that a small number of older adults do genuinely benefit from limited use of sleep medication. If your insomnia is acute, triggered by a stressful life event or a short-term medical issue, a few nights of sedation might help you bounce back. But that scenario differs from having an ongoing prescription you rely on for months or years. The real danger is creeping reliance. If you find yourself needing the medication more and more often, or noticing it's less effective and needing a higher dose, that's a red flag. At that point, you're veering into a territory where the drug's hold on you could overshadow your original reason for taking it. Some seniors even become anxious about traveling without their pills, or worry they won't sleep at all if they skip a dose. That's a sign the medication might be controlling you more than it's helping you. It can also affect your daytime relationships and engagements. If you're groggy in the morning or dealing with memory lapses, you might withdraw from social situations or fear embarrassment around friends. Isolation can creep in, further fueling the insomnia at night. Likewise, if your reaction time is slowed, you might give up certain hobbies or activities you once enjoyed, like driving short distances or gardening, because you don't trust your coordination. In that sense, the pill you took to preserve your night's rest can ironically limit your daytime independence. That's rarely the outcome doctors intend, but it's a real possibility if no one monitors how the medication affects your daily functioning. For those concerned about ongoing poor sleep, there are resources to help you reevaluate your night routine. A sleep study can reveal whether you have undiagnosed sleep apnea, which might be the real culprit behind your fatigue. Some older adults have mild to moderate sleep apnea that's never been identified, leading them to wake dozens of times each night, gasping for air. No sleeping pill can fix that mechanical issue of airway collapse. In fact, sedation might worsen it. Treating apnea with a CPAP machine or a simpler device, if your case is mild, can do far more for your alertness than any pill. Similarly, if depression is fueling your insomnia, therapy or an appropriate antidepressant might be the more direct route than taking a sedative. If chronic pain is robbing you of sleep, seeing a specialist to adjust your pain management could yield better nights and improved life quality. In short, these deeper investigations take time and curiosity, both from you and your healthcare provider, but can free you from the short-sighted solution of sedation that dulls symptoms without remedying causes. Let's not forget lifestyle factors that might shift in older age. You may be less physically active during the day, which can reduce the natural fatigue that leads to easy sleep. If you notice a correlation between days you move more, like gentle walks or light gardening, and nights you rest better, you already have a clue that daytime activity fosters nighttime slumber. Yet if you rely on a sleeping pill, you might lose motivation to incorporate exercise or fresh air into your schedule. Similarly, some seniors engage in prolonged daytime naps out of boredom or habit, which disrupt the body's bedtime signals. If you cut back on midday snoozes, you might find your nighttime exhaustion returns in a healthy way. But you'll never discover that if you mask the problem with sedation. Another pattern is using screens, TV, tablets, or phones, late into the evening. The blue light they emit can trick your brain into thinking it's not bedtime yet, messing with the release of melatonin. Instead of popping a pill to override that confusion, turning off devices an hour before bed could help you drift off naturally. These small shifts in daily habits might sound too simplistic, but they often yield strong results, especially when combined with a calmer evening routine. If you suspect your sleeping pill might be doing more harm than good, speak openly with your doctor about tapering off. Don't just stop abruptly, especially with benzodiazepines, as withdrawal can be severe. Ask for a gradual reduction schedule and in parallel adopt alternative sleep strategies. You may want the guidance of a counselor or therapist if anxiety underpins your insomnia. Or you might try mild herbal teas and see if they help once you're off the stronger medication. It might be a bumpy transition. Your insomnia could flare up at first, but many seniors find that once their body recalibrates, they achieve more refreshing sleep of their own accord. Their dreams become richer, and they wake feeling clearer-headed without the chemical hangover. They also reduce the risk of accidents and the slow mental haze that sedation can cast. In summation, your doctor might not detail the full picture of sleeping pills for seniors over 65, either from time constraints or habit. Yet the hidden pitfalls, prolonged sedation, fall risk, memory impairment, possible dependence, and failure to address underlying sleep barriers can undercut your day-to-day living more than you realize. If you're among the many older adults quietly relying on these medications, consider whether you'd rather keep sedation as a permanent fixture or investigate more root-level solutions. Sleep is vital, but there are less hazardous ways to reclaim it. From short walks to reduce daytime restlessness, to adjusting meal times, from CBT for insomnia to exploring any pain or mental health concerns, the path might require more effort than taking a pill. Still, the payoff in sustained well-being and genuine rest can be worth every step. You could preserve your mental clarity and reduce your risk of falls, continuing to do the things that give life zest. No medication is inherently evil, but the mismatch between short-term sedation and long-term healthy aging is often overlooked. Now that you're aware of the dangers, you can weigh your options more clearly. Maybe a week or two of sedation is warranted if you're in crisis, but letting it extend beyond that could be playing with a silent fire. Open conversation with your doctor, or even seeking a second opinion, can illuminate alternatives you might not have known existed. Each night you spend in natural, unhindered sleep is a gift to your senior years, a chance to rebuild your energy and keep your mind sharp. And that's something you can't fully reclaim if you're trapped under the drowsy spell of a pill, morning after morning. Let this awareness guide you to safer, more effective ways of embracing the restorative power of sleep without paying a steep price in your waking hours.